Hello, my name is Dr. Komoshi. I'm a GP at King's North Medical Practice in Ashford. In this series, we talk about common health conditions that could be treated at home without the need to see the doctor. Earache is very painful and prompts patients and parents to seek help urgently. The sensation of the earache is very similar regardless of the cause of the pain. There's only a few conditions can give you earache, so it's not hard to tease out what's going on. In the absence of trauma, the three main causes for ear pain would be ear canal blockage, called Eustachian tube dysfunction, infection in the middle ear, and infection of the ear canal. It is very common for a viral infection that causes cough, cold, and sore throat to cause blockage at the Eustachian tube, which connects the middle ear and the throat. So if there is throat swelling, often it blocks the Eustachian tube and there's not enough air going up to the middle ear, causing the sensation of blockage. Hay fever can also cause similar symptoms. The pain is sometimes intermittent, as some air might get in and eases the pain. We can actually force air into the middle ear by pinching the nose and blowing hard. It temporarily can increase the pain, but after a few minutes it settles. It also confirms the diagnosis of Eustachian tube dysfunction. Sometimes the patient cannot unblock the ear because the blockage is too tight and the patient can't force the air in and only the other ear pops. It also confirms the diagnosis. The treatment is to unblock the Eustachian tube, which is best done by steroid nasal spray. Baconase is available over the counter without a prescription. It's not instant though, it takes a few days to take effect. Steam inhalation can give you a more instant, however temporary relief. If the virus itself spreads from the throat to the middle ear, it can cause a middle ear infection. In this case, the patient might have high temperature as well. If the child is generally well and there is no pus coming out from the ear, there's no need for antibiotics, as it's most commonly a viral infection and it resolves within 3 days. However, it can last up to 1 week. If the patient is generally very unwell, if there are symptoms in both ears and ear discharge, which is white, pussy or watery discharge, it might mean there's a bacterial infection going on and antibiotics might be beneficial. So if there is high temperature together with ear pain on both sides, the patient is generally very unwell, or pussy discharge coming out from the ear, please make an appointment with your doctor because antibiotic prescription might be necessary. Most ear infections have a viral and there's no need for antibiotic prescribing. As I say, it resolves within 3 to 7 days. There is a rare complication called mastoiditis. If there is pain, redness and swelling behind the ear on the hard bone, in that case the patient definitely needs medical attention. Ear canal infection often comes with ear pain and discharge with reduced hearing. The patient might report history of swimming or use of cotton buds to clean the ears. These are most common culprits for an ear canal infection. However, a lot of the times we can't see any apparent reason what might have caused the infection. If I talk to a patient over the phone assessing their ear pain, I ask them to put their little finger into the good ear and have a feel about, given that they don't have long false nails, because then it would be dangerous. And then to put the little finger into the painful ear and have a feel around. If they report that it feels narrowed and it feels wet and it's very painful, then it practically confirms the diagnosis of an ear canal infection, and I often issue the prescription for antibiotic and steroid combination ear spray over the phone. A rare complication could be that the ear canal infection spreads outside, affecting this little tragus or the pinna of the outside of the ear. If it goes red, painful, swollen and shiny, then the patient needs oral antibiotics and medical attention. I hope that this video helps you to decide whether you need to see the doctor or you can safely wait for your ear pain to go, and you can use over-the-counter paracetamol and ibuprofen to ease the pain. I understand it's a very painful condition, so ask advice from your pharmacist what is available for you for pain relief. If your immune system is weak due to underlying illness or treatment that you are receiving, please have a lower threshold to see your doctor, especially if you develop high temperatures, higher than 38.5. I hope you will get better soon.